Hey everybody, how are you? Hope you are well. So before we get started, hit that like button. So as you know, I'm a doctor of pharmacy. I'm also a real estate investor. As you know, I'm interested in finances. All right, but today we're going to go to the health side and we're going to talk about Alzheimer's and the new drug that they have out called Legembi. So what this is it's a monoclonal antibody and it attacks the proteins that build up in the brain for people that have Alzheimer's. So it's called beta amyloid. And so this drug is attacking the protein. The goal is to get rid of that plaque buildup. And so that's essentially what this drug is doing. It does not cure Alzheimer's, unfortunately, but it does slow down the progression where people start to lose their memory and their thinking. It slows it down. And so they did a study of 1,800 people, and they concluded that it slows decline down for 5 months. This is based on the study that they did. They do have clinical trials going on for people who are interested. If you know anyone who is affected or anything, they have clinical trials going on over in St. Louis. This is at Washington University. And so this drug is out. It has full FDA approval. And so what is happening is that there are Alzheimer's advocates. They are pushing for a cure for this. So there's Alzheimer's advocates, and what they are doing is they are lobbying the federal government because they tend not to pay for certain medications unless it has full FDA approval. So there is a political component to this. They're lobbying the federal government. And so you have this political thing going on. And then the FDA approves this drug, Legembi. So there was an Alzheimer's drug in the past called Adulhem. You may remember in 2021. And they didn't have any evidence that it does anything. So doctors were refusing to give it. So that's pretty honorable that they would refuse to give something that there's no evidence that it works. Also, Medicare didn't cover it. So that was Adulhem back in 2021. Now they have Legembi, which has full FDA approval. It will be covered by Medicare pretty shortly, and Medicare is for age 65 and over. So it will be approved by Medicare. The cost of the drug, if you don't have insurance, $26,500 a year. $26,500 a year. It comes in IV format, and it does have a potential serious life-threatening side effect, which is rare, and that is bleeding in the brain and swelling in the brain, which could be life-threatening. So people that are on this medication, it's recommended that they go get brain scans, periodic brain scans, to detect any side effects. So very important for this medication. They're saying that the side effect is rare. However, this monitoring of the brain is pretty important because it has a side effect and they know about it. But they're saying that it is rare. So again, it works to remove the beta amyloid that builds up in the brain. And although it doesn't cure Alzheimer's, it's slowing it down. It's slowing the decline down so that they can still have their memory and still have their thinking. It's working for 5 months, according to the studies that they have come out with. So This is the first drug that is shown to slow down Alzheimer's. The first drug that's shown to slow down Alzheimer's. So some people who are affected by this are happy about the news, that at least they are working on the disease. So again, it does not stop it. It does not reverse it, only slows it down. And it decreases the decline by 27% after 18 months of treatment. All right. So it's getting rid of that buildup in the brain, beta amyloid, which is a type of protein. So this is what is going on in the health space. So you know that I talk about money. This is a money channel. So what does this have to do with money? Well, if you're in the stock market, there are plenty of pharmaceutical companies in the stock market. So this drug is made by a Japanese company, and they're partnering with Biogen, right? So the Japanese company is called Eisai. Eisai, that's a Japanese company. They're partnering with Biogen. So generally what happens is when you're in the stock market, there are pharmaceutical companies in there as part of the health segment. And then you have all these different sectors of the stock market to complete the stock market as a whole. So when you're in there, like they're coming up with new drugs all the time. And so people who are in the stock market, they profit from what is going on. So it's not all about money all the time. It's about helping people, whether that be helping people with serious diseases or helping people to improve their finances. So both are important. All right. So helping people, that's what's important. All right. But I did want to come in. If you got any value from this, hit the like button and the subscribe button. If you're not a subscriber, a notification bell next to it so that you won't miss an episode. Again, as far as this drug goes, it's an IV drug and it slows it down, doesn't stop it or reverse it. Some people are happy about that they're working on the disease. There are advocates out here, Alzheimer's advocates. They're lobbying the federal government to do something and essentially pay. So it has to go through FDA approval before Medicare will pay for it. So that's what the people that lobby the federal government, that's what they do. So this advocate group, they're looking out specifically focused on people who are affected by Alzheimer's. All right, so that is what is going on. So if you like this channel, hit the like button. If you're not a subscriber, hit the subscribe button. And I have a question for you. Are you in the stock market? If you like to learn how to invest, say you are brand new to the stock market, or you would just like to improve on your investing, you can check out the link below. Stock market is very important. So people are building their wealth, right? And it's not in school purposefully. Did you ever learn how to invest in school? Why do you think that is? Because they don't want you to know how to invest. So check out the link below. And don't forget, on your way out, hit that like button and the subscribe button if you're not a subscriber. Thank you for watching. Have a good rest of your day.